Today, I'm going to talk to you a little bit about writing a research question, writing your aims and objectives, and a little bit about title as well. So, how do we come up with a good research question? So, that's kind of one of the most important things you can think about when putting together your application. So to work out what we mean by good and how we go about thinking about it, we need to think about what criteria will the question be judged on, and then how can we articulate that question in a single sentence so that it is clear to the panel exactly what it is we are trying to do. So to think a little bit about criteria. So this is quite a lot of detail here, but you need to write a background section, and your background section for your application will need to contain all of these questions that I've got listed on this slide. And by doing that, you will then be able to hopefully form a good research question from that. So you might not be able to answer all the questions straight away, but by doing a bit of research, hopefully you'll be able to find answers to all of these questions to help you form the background section, and then how to make sure that you've got a really good, clear research question. So the things that we need to think about are, how bad is the problem? What's the case for this piece of research? What don't we know yet? So what is the research going to answer? Why might this project help answer that? Will doing this piece of research make a noticeable change to patients? And is there anyone out there calling for this piece of research other than just you as a researcher who's got this idea to do this research? Alongside that, it is really important to think about any funder-specific criteria. So, for example, NIHR, we've got the NIHR funding programs listed on this slide. They're largely interested in projects that are going to have an impact on patients in the sort of short to medium term. Each program or funder will have their own priorities, and they might have a standardized form with standard boxes on them, but within those boxes you need to explain why it meets the criteria of that particular funder. So every funder will have their own guidance, and it will be different guidance for each of the funders. So read their guidance and make sure you meet their particular criteria that they're interested in seeing in studies they fund. Probably also worth thinking about phoning the funder or emailing the funder. So all the NIHR funders and all the UKRI funders are really keen to talk to researchers before people putting applications, because they also want to make sure that they receive applications in remit. So if you're unsure, most funders will accept a one-page overview of your project, and they would give you some feedback. Normally in sort of fairly loose terms, yes, this is likely to be in remit because, or no, it's unlikely to be in remit. Have you thought about trying X, Y, Z? So it won't be like detailed methodological advice. It will be just that, broad feedback that yes, you're on the right line. So yeah, carry on applying to us. And it would stop you applying hopefully then to the wrong program and wasting lots of time, because it's hard work putting the application together. So let's go back to those individual questions that I had on my slide a couple of slides ago. So the evidence for the problem. So how bad is the problem? So this could be the number of people affected. So it could be a common condition that affects a lot of people, or it could be a rare disease that affects a small number of people. So you just need to explain, what that scale is. Explain what the impact is on the person as an individual. Is it a condition that affects their everyday life significantly, or does it have milder impact on the individual? Think about the cost of carers as well, the impact on the NHS, so NHS resources, how much resource time does it use, and also about the cost. That could be the cost of current interventions, or it could be the cost of actually treating people with this condition. So think about that side of it as well. Think about what don't we know yet. So use literature to support this. So what do we know, what don't we know, and how might your research bridge that gap? And try and explain it in clear terms. Don't the funders want to know tons about, you know, what's happened before. They want to know what has happened before, and they don't want to know tons that could happen in the future. They want to know a little bit of where the impact of your project could be. But they really, really want to know is how your research can answer that gap between, you know, what we do know and what we don't know. So it might be helpful to use a logic model to help think through that. So for example, you know, what is the problem? What's the underlying cause? This is the proposed solution. This is why we think it might tackle the cause of the problem. And, you know, and we're changing this criteria, so therefore that will have an impact on this criterion. So, and then think through how the impact of your piece of research will inform future practice. So sometimes it's helpful to think through in a logic model way. So back to those questions. So the need for evidence. So will this piece of research that you're planning to do make a noticeable change? So for example, are you targeting a large proportion of the population? Particularly important when you are looking at quite a common condition. And also when you're looking at a rare condition, you know, sometimes people have got applications that look at, you know, there's 5 people in the country, you're going to need to recruit all 5 of those people. So it just explain, you know, the target that the target population you're aiming to recruit. Talk about whether this is a minor or a major cause or a problem in these people. And then think, you know, talk about how this will pave the way forward to future research and future treatment for these patients as well. So who is calling for this work? So this slide is all about trying to get some enthusiasm for other people who might not really understand your area particularly well. So funding boards generally may only have one person who understands your area of research really well. Some boards might not have any that know your area particularly well. So by showing that other people are really excited in your research, not just you, it can be really impactful for that funding board. So this is all about trying to share that enthusiasm, share with the funding board that, you know, your work's really important. You know, why does, you know, try and make your work stand out, because everyone on that, you know, funding board will have their own research areas, and they also know that everyone feels passionate about their own research, but they want to feel passionate about yours as well. And, you know, what makes yours different? So can you demonstrate that somebody else is calling for research in, you know, in your area, and that your project will answer their need? So examples of ways of showing that somebody else is interested in what you're doing. So for example, NIHR have got various areas of strategic priorities. If your work links to one of those strategic priorities, say it. You know, for example, NIHR is really interested in multiple long-term conditions. If you're doing some work in multiple long-term conditions, refer to their guidance and their policy that they've got on their website. Have NICE looked at it recently, and have they got a research recommendation in their guidance? If so, reference it. They also quite often have systematic reviews as part of their NICE appraisal process. Use those as well, so it will give real weight to your research question. The James Lind Alliance. So this is an organisation that brings together clinicians and the wider public to set fairly broad priorities on the whole. But they are priorities and uncertainties where research should be carried out. So they are all available on their website. So look to see if your research matches any of these. Talk to patient groups. You know, are they looking for research in this area? You know, would they be willing to support your area of work? Talk to professional bodies, so talk to like the Royal Colleges, or talk to other organisations like that. You know, are they calling for work? Talk to charities, just engage broadly. So if you identify anything that matches up with your research, can you work with these organisations to to develop your thinking and to get them on board with your thinking? Also worth noting, if you do find uncertainties in either the James Lind Alliance or the NICE research recommendations, which you think that your research answers directly, there are 2 ongoing calls worth noting for NIHR. So with free close dates every year, for a number of the NIHR programs, they have ongoing commission calls, which are only for applications which either address a JLA PSP uncertainty or a NICE research recommendation. And these are, like I say, rolling calls. They have 3 close dates a year, and then worth investigating if you think that your research is actually related directly to a NICE research recommendation or a JLA PSP. They generally don't get many applications per close date, so competition's generally a little bit lower, but you need to be really clear that your research answers one of these directly. I think I've just seen pop in the chat what they're called. So they're called the NICE rolling call and the James Lind Alliance rolling call. They are the names. If you type those in the NIHR website, you'll find a link to them. So let's go for an example of how you would start to think about developing a research question, and then from that, aims and objectives. So we are going to use an example here where the Royal College of Physicians, so a national body, has called for, has written a report around COPD and the uptake of pulmonary rehabilitation, and it noted that it was only an uptake of 69%. And the report highlighted that this is worth exploring. Can we improve uptake in this? So in this example, we think that's a good idea, and we ought to see if we can improve uptake in this, because PR is obviously a really important way of treating COPD. So we're interested in finding out how we can increase the uptake. So to start off, what I'm going to do, I'm going to talk to some clinicians, and I'm going to find out, what is the actual issue. So I'm going to speak to my clinicians, and they've said that that what they've heard back from their patients is that there's a problem with, they're not actually quite sure what to expect when they turn up to these appointments. So that could potentially lead to people not wanting to engage, and therefore not turning up if they're not quite sure what they're going to get and what they're going to get out of it. So from a clinical point of view, what the clinical colleagues are really worried about is the impact this is having on resources and the cost of wasted appointments. So they are particularly interested to investigate that side of it, to see if we can increase uptake and then reduce the wasted cost. And what patients are really concerned about is that because they don't know what to expect, they don't really know whether they should go along to the appointment, and they would like more evidence or more guidance early on in the process to say this will really help you, at least to big improvements in your condition, and therefore patients felt that they would be more likely to engage. We don't really have the evidence necessarily to support that at this stage, but that is just our early thinking from talking to clinicians and patients, that would be an important thing, would be that further engagement up front, so that they could attend the appointment and understand what they're going to get out of it. So let's go and seek some further guidance. So we're going to speak to the Royal College of Physicians, because they were the national committee. So they want to understand how can we improve the uptake of PR in these COPD patients. And their sort of thinking is, can we do anything differently? So we talk to clinicians and patients, and we try and understand why people aren't attending their PR appointments. And what we hear through that is that clinical staff and patients say they're not quite sure what they're selling. So GPs, respiratory nurses, practitioners are busy individuals, and they see they have a role in encouraging behaviour change, but they're not quite sure how to sell that to patients, because they also note that most of the invitations are sent out via written response. They don't get a chance to explain the benefit of attending these appointments. And what patients are saying is that they don't understand why they should attend these appointments, because it's not really explained to them what the benefit is to them. So based on that, we go and do some literature work. So let's consult the literature, let's understand what the literature says. And that also confirms that, most approaches are through a written approach. There's some varying, but it suggests that 88% of patients are approached via a written letter in the first instance. And there is no gold standard to suggest what should be in that written information. And it's quite variable about what patients receive. So that starts us thinking, can we do something differently about that? So can we maybe use phone calls? Would phone call, explaining to patients what they're going to receive, improve uptake? So by thinking through that, we can start to think through, okay, so referrers aren't reflecting the positive expectations via a letter, and also patients aren't receiving the positive information they need to attend these appointments. So how can we improve this and get across the way that it's really important, for patients to attend this? And we're aware from other work that we've been doing that some people have been using motivational interviewing as a tool to help. And we're wondering whether that could be something which we could cross-generalize this instance, because by doing that, we will really engage patients early on. They will really understand the benefit of going. So by searching literature further, we find that there's not much use of this in respiratory conditions, but there are in lots of other conditions, and it has really benefited in helping patients turn up to appointments. So we're wondering if this is a mechanism which we could explore further to see if we can improve PR uptake in these COPD patients. And what I've sort of explained here, I'm not saying is the only way to approach the problem, but it's just an example of how you might start to engage patients, engage national organisations, consult literature, and then piece together background information from other things to come up with how you might start to approach this uncertainty from a national organisation. So let's go back to those initial questions that we had on the first slide. So let's think about how bad a problem is. So we can talk about that in terms of the benefits we know of PR and why it's really important that patients take this up. We can talk about the scale and problem of COPD, how many patients are affected and how many people are referred on to PR. And then we can also talk about to the extent to think about why that isn't being taken up. And that would help to explain how bad the problem is. What don't we know yet? So we've come up with this idea that motivational interviewing might be able to increase the uptake of PR, but we don't know. We're using information from the literature, and we think it could be a tool which could be helpful in this instance. So we don't know if it works. That's our uncertainty. Why do we think this is going to work? So again, based on literature, so in other fields, motivational interviewing has been shown to help people understand the benefit of their treatment. So it could be used in this instance to help people understand the benefit of attending their PR appointments. And it may also overcome some of those communication issues that the clinicians are mentioning about. It was coming via a letter, and they weren't able to explain the benefit necessarily of turning up. And patients were also saying that they couldn't understand why they should go to the appointment, what was the benefit to them. So it would start to overcome those communication issues that we have from both clinician points of view and from patients' points of view. Will it make a notable change? So improving uptake has a really great chance of making a really important difference. So it is a recommended treatment for people with COPDs, and therefore is likely to help their condition and help them manage their symptoms. So likely to make a really important change. It might also reduce other contact with healthcare professionals and attending to emergency service clinics because their symptoms are more under control. So potential to sort of impact on costs as well. So really important. And then who's calling for this work? Well, we know that professional bodies are calling for it because that's come out of this review done by the Royal College of Physicians. We know clinicians are calling for it. We know patients are calling for it based on the conversations that we've had. So it feels like there's strong backing for this research idea, and it's not just our idea. So it feels like everyone's in support, and then we can write that in our application. So let's think back to writing a research question. So we've done all that background thinking, we've sort of got a case, we've got a bit of rationale as to why we might undertake our study, and we've kind of got a few ideas of how we might take it forward. So let's think how we might start to phrase that research question. So we're basically asking, does motivational interviewing improve uptake of PR? And could it be clearer? Does that really say what we want to do in our projects? Let's think a little bit more about that. So I've highlighted the word improve. What do we mean by improve? Improve compared to what? What are we comparing this to? So think that through and try and get that in the research question. So we are now asking the question of, does motivational interviewing improve uptake of PR compared to usual care? And the usual care in this instance is just sending a letter out in the post. So that starts to sort of articulate a bit more clearly about what we are trying to do. Let's break it down a bit further. So uptake of PR. What do we mean by uptake? Can we be more precise in that wording? And also the word does. What do we mean by the word does? Are we looking at is it effective? Is it efficacious? Is it a feasibility study? Try and get a bit more detail in there to what we mean by the word does. So for example, you could change this into, what is the effectiveness of motivational interviewing compared to usual care in the uptake of PR? So we've tried to get across there all the elements of our project that we want to do. So our intervention is our motivational interviewing. Our condition is our PR, and we want to know, is it effective? Is it going to change and have improved outcomes? So it's quite clear from that kind of what we want to do, and it's in a single sentence, fairly easy to understand for people who don't necessarily understand the area. And just to talk through that thought process, that is basically following a PICO format. So PICO is a term which NIHR and other health funders, so MRC, UKRI use a lot, and it stands for PICO, and that's defining P for population, defining who your population is. So in this instance, it is people with COPD and those who are referred for PR. Our intervention is motivational interviewing. So does adding an interview improve the uptake of PR? Our comparator is usual care in this instance. It can be placebo, it can be another gold standard. And our outcome is, are we changing the uptake of PR? So that's kind of the thought process that I went through to outline what we need to include in the title, because that includes all the key elements there in a nice, easy, accessible format. Just to note, PICO is really just a framework. It's just a way to think something through systematically to include all the elements of your project. I know PICO isn't particularly relevant to some projects, so there are other frameworks out there. I have by no means included all of them over the next couple of slides, but I have included some other common examples just in case your project doesn't fit into that standard PICO format. So there is a PECO, which can be used for observational studies, and that in the slides, and I won't go through more in a lot of detail because there's not enough time, but it outlines what you'd include in that PECO format if that was relevant for your study. There is a CCP, so this is a study which will be looking at the prevalence of condition or a disease problem, but you don't actually have to have an intervention defined or identified at that point. So it's all about setting out the condition, what the context is, and what the population is you might do the work in. And then the final one I've got here is SPICE, which is a framework for using qualitative questions and evaluating experiences and meaningfulness. And they are sort of 3 fairly well-known ones that are used when PICO is not relevant. Like I say, there are tons more out there. I'm sure if you Google them, you'll find lots more. So I wanted then just to talk about aims and go into objectives as well. So we've got a research question. It's quite easy to change a research question into an aim. So it's got all the same key elements. I don't necessarily feel you can define an aim and a research question. I think you probably just want to define one because they're both fairly top level, and talk about the same sort of key elements within them. And you can very easily turn a research question into an aim. You just take out the question. So I am investigating the effect of motivational interviewing compared to usual care on uptake of PR. So exactly the same information in there, it's just been rephrased from a question. So a bit more about aims going into objectives. So once you've got an aim or a research question, it's then breaking those down into objectives. So they don't have to be a load of detail in an aim and objective. You need to have short sentences, and they don't need to go into depth around necessarily what the analysis is or the other details. You kind of think of objectives as your bones. So these are just outlining what the project is. And they want to capture the major milestones or the components of a study so that you're kind of preparing the reader for what's going to come later on in the application and down into the project plan. So, for example, if you've got a nested qualitative study, you should probably highlight it as an objective. And I'd use a section to really sort of allow some discussion and rationale to, for why you're doing these objectives if they're not clear from the research question or the aim or even from the background, but use the background to really expand on it. But you're just trying to, that clear sort of, this is what I'm going to do. So for example, you should use your aim to talk about what is appropriate for the study. So for example, you need to use, it's a feasibility study, don't talk about effectiveness or efficacy. It should be sort of, mention a qualitative, mention quantitative. So that I say the top level key information that the reader needs to know to sort of orientate them through your study. So objectives are really there just to be that primer for the reader. So they are the major parts of your study. Like I said, they're quite a lot of them there to sort of orientate the methodologist really, so they know where to look for certain bits in your project. So within them, you need to highlight all the major bits. So for example, if it's a feasibility study, talk about the feasibility elements, don't talk about effectiveness. If it's got a qualitative study, mention it here. If it's got cost effectiveness, again, mention it here. So pick out what are the key bits of your project in your objectives. So let's go through what the objectives would be in our worked example. So the objectives are to refine face-to-face motivational interviewing intervention for use over the telephone, because we're not going to meet people, we're going to refine it for use over the phone. So that's a kind of a key point to sort of get us ready to do the project. Objective 2 is kind of the main piece of this work that we're going to do. So this is actually what we want to do. This is the effectiveness of using motivational interviewing to improve the uptake of PR. Then 3 is just to, it's a quantitative assessment of, did it actually work or not, essentially. And this is a basis for which we're investigating the effect that our study is going to have. So really important to include this in here. And then point 4 and point 5, these are bits of the study are going to explore in more detail some of the qualitative elements of it. So, what's good or bad about doing this, how do different people feel about it, and it will help sort of guide effectiveness as well. And these are sort of nested within there, so they're not the main objective, they're nested within our project, and they are secondary to our sort of our main objective is this effective or not. Probably worth noting, if you've got a large project and you've got lots of work packages, try and link objectives to work packages. Again, it just orientates the reader. It can be quite complicated if you've got quite a complex study and you've got an aim and a research question, and then you've got a list of objectives and you've got a list of work packages. Try and link those work packages back to the objectives so it's really clear to the reader. Work package 1 is going to answer objective 1. Work package 2 is going to answer objective 2. And it just makes it a lot clearer for the reader as they're going through your project to see how each work package actually then links back to your objective and your main research question and aim. So this is just an approach. It's not the only approach to do it. It's just a way to try and structure your thinking and your project plan, because it gives you a list of objectives to follow, and it tries to do it in a really succinct way without trying to overcomplicate the situation. And it makes it easy for people to refer back, because I think we've said several times during the day already, boards have lots of these to look at, so therefore a limited time to look at your application. You want to make it really straightforward and really hard hitting as to this is my research question and these are my objectives, and you can follow it easily through, because if you look at work package 2, that really clearly links back to my objective 2, and it just makes it really easy for the reader to then refer back through the project plan if they want to match things up. So let's talk very briefly about title. So avoid technical phrases and abbreviations. Don't make it long. People don't want to have to take 3 or 4 breaths to read your title. It's supposed to be a really quick intro to your project. Make it easy for people to remember. So remember, they might be looking at 20 applications that day. Make yours stand out, make it easy to remember, and make sure it captures the essence of your project. So here I've given an example of how you might make this our example into a title. So investigating motivational interview to improve uptake of PR in a randomized controlled trial. So it gives a little bit about methodology. It tells us what the intervention is, what the patient group is, and what we're looking to do in a really simple, concise way. I know people like to think about acronyms, and I think people often think NIHR like acronyms and they should include an acronym in their project. You don't have to. I've sat at many a funding board meeting where boards don't like it when it's obviously will spend a lot of time thinking up that catchy acronym to put in there. You don't need it. If one falls out naturally, great. Don't try and find one where there isn't one. So in summary, try and have one research question, one aim. Make sure it's really easy to find, really watertight, and take time then to craft your objectives, to lay out how you're going to achieve your aim or your research question, and consider your title carefully, as this is the kind of the face of your application. It's the thing that everyone reads first when they look at your application. So make sure it nicely captures what you're planning to do in your application. And then here are some references which you may find helpful when putting things together. And then a link to our support service there